Hi, I'm Prof.Muvunga, NP student at Athabasca University. I will discuss how NP-led care models affect health and wellness indicators of First Nations and Inuit people in Canada's rural areas. The leading question was designed using the PICO framework to identify the target population, the intervention, the comparator, and the outcome. And as such, the question was framed: how do NP-led care models impact First Nations and Inuit people's health and wellness indicators in Canada's rural areas? The health and wellness indicators. The First Nations and Inuit health and wellness indicators offer a snapshot of important aspects of health of First Nations people and Inuit. These indicators are organized into 4 categories: demographics, health status and outcomes, determinants of health, and health systems performance. The NP practice in rural Canada has historical roots, but its utilization varies across remote First Nations and Inuit communities. For instance, Alberta emphasizes NP-led consultations, while Manitoba relies more on doctors and physician assistants, illustrating inconsistent healthcare approaches and the need for a unified strategy for NP integration. What does the NP-led care model look like? NPs operate both independently and collaboratively with interdisciplinary teams to assess, diagnose, treat, prescribe medication, order and interpret diagnostic tests, provide health education and counseling, and deliver comprehensive case management. Research demonstrates that NP-led care models often produce outcomes comparable to or even better than traditional medical care. These models are associated with significant benefits such as improving symptoms management, enhancing chronic disease management, increasing adherence to therapy, raising patient satisfaction, improving access to comprehensive primary care, empowering and training other nursing staff, and some cost effectiveness. However, some key considerations for successful implementation include addressing patient vulnerabilities and social determinants of health, ensuring healthcare workforce sustainability and support, strengthening interprofessional team functioning and communication, and finally, securing sustainable funding and policy support. In conclusion, this is a critical opportunity to address the well-documented barriers to equitable health care in these regions. And here is the list of references. Thank you.